Now I'd like to introduce the speaker for today. Dr. Dan Kenna is a licensed practitioner of Oriental medicine, both in the US and in Japan. He has consulted with cancer patients for nearly 30 years on immune restoration and finding resources for longevity and well-being. Dr. Kenna, would you please start your lecture?
Yes, thank you. I'll tell you, first of all, just a little bit more about me. I have worked with a lot of cancer patients because I have a book that came out a few years ago called The Whole Body Workbook for Cancer. And the second edition will come out later this year, and it's going to have a lot of this information in it because I'm very excited about it. When I see cancer patients, I work with them to some extent on lifestyle. Most of the people that I see also plan to do conventional treatment, which includes, of course, surgery, chemotherapy, and radiation. But there are three things that I always recommend to cancer patients, and the first one is BioBran. And more recently, I have been encouraging people to use BioBran along with curcumin because of the book that has just come out by Dr. Gerasenos, where he says that the BioBran and the curcumin are very powerful when they're used together. And then I also recommend to cancer patients to use some type of proteolytic enzymes. Now, these are enzymes that break down proteins, and they have some anti-cancer effect, and they have anti-inflammatory effect. And Daiwa has a product called Plasminex, which is a type of proteolytic enzyme product. But I think these things are very important as supplements. And if their doctor or their oncologist is nervous about their patient taking supplements, I encourage them to look at the amount of research that there is and the safety record. And that's what we want to go over today. We'll be talking mostly about cancer, but I want to touch on some other aspects of using BioBran clinically. So let's have the next slide, please. So the life expectancy of the Japanese is the highest life expectancy in the world for males and females, and using BioBran clinically.
Okay, it's 2 p.m. in Tokyo, so it's time to start. So good morning, good afternoon, and good evening, everyone from different time zones. Good afternoon. Can everyone hear me?
Yes.
Great. Okay, welcome to today's Daiwa webinar. Thank you for taking time out and being here today. It goes without saying that COVID-19 crisis has restricted us to go abroad. So we have lost our opportunities to meet you in person for quite a long time now. So it is very nice to meet you even in this online platform. We know that some of you have already been active to hold online seminars for your customers and clients. However, this is our first official online seminar after the pandemic. So we have to say that we are a little behind in this field, yet we are very confident that today's lecture is productive for you all. My name is Yasuko Kikuchi, and I'll be your host for today. Before we get started, I'd like to go over a few items so you know how to participate in today's webinar. First of all, please set your microphone on mute during the webinar. If you don't know how to do it, don't worry, we will turn it off at our end. Secondly, we know that today's topic may bring up a number of questions from you, and we want to let you know that we will address as many as we can in the time we have today. So please write your questions if you have in the chat box during the lecture, and we will discuss those questions after. Okay. Now, our Executive Director, Nori Shirai, would like to deliver a message to you.
Hello, everyone. Thank you for joining us today. My name is, most of you know me, I hope, but some of you don't know me. Let me briefly introduce myself. My name is Nori Shirai. of Daiwa Pharmaceutical. I'm an executive director of Daiwa Pharmaceutical in charge of international marketing. And today, thank you for joining us today. Good morning to Dubai, and good morning to some of the Asian countries, and good morning to some of the other good afternoon to some of the other Asian countries, including us, and definitely good afternoon to Sydney, Australia, and good evening to California, USA. And we're really happy that we can see your faces. The reason we had created these opportunities is exactly Yasuko said. Before COVID-19, we can see you face to face, and we can visit you. You can visit us, and we had the business meeting face to face, and we not just a business meeting. We had enjoyed the conversation, dinner together, and we really enjoyed it. But right now, because of this, we lost this opportunity. So we thought that we may have to create some opportunities so that we taking advantage of technology. We can see you, even if it's on the Zoom, but it's better than nothing. So we created this opportunity. Today, I hope you could get a good, very good information, good knowledge. I hope you could take away some of them, and I hope you can enjoy it. Thank you so much for joining us. Back to Yasuko.
Thank you, Nori. Now I'd like to introduce the speaker for today. Dr. Dan Kenna is a licensed practitioner of Oriental medicine, both in the US and in Japan. He has consulted with cancer patients for nearly 30 years on immune restoration and finding resources for longevity and well-being. Dr. Kenna, would you please start your lecture?
Yes, thank you. I'll tell you, first of all, just a little bit more about me. I have worked with a lot of cancer patients because I have a book that came out a few years ago called The Whole Body Workbook for Cancer. And the second edition will come out later this year, and it's going to have a lot of this information in it because I'm very excited about it. When I see cancer patients, I work with them to some extent on lifestyle. Most of the people that I see also plan to do conventional treatment, which includes, of course, surgery, chemotherapy, and radiation. But there are three things that I always recommend to cancer patients, and the first one is BioBran. And more recently, I have been encouraging people to use BioBran along with curcumin because of the book that has just come out by Dr. Gerasimus, where he says that the BioBran and the curcumin are very powerful when they're used together. And then I also recommend to cancer patients to use some type of proteolytic enzymes. Now, these are enzymes that break down proteins, and they have some anti-cancer effect, and they have anti-inflammatory effect. And Daiwa has a product called Plasminex, which is a type of proteolytic enzyme product. But I think these things are very important as supplements. And if their doctor or their oncologist is nervous about their patient taking supplements, I encourage them to look at the amount of research that there is and the safety record. And that's what we want to go over today. We'll be talking mostly about cancer, but I want to touch on some other aspects of using BioBran clinically. So let's have the next slide, please. So the life expectancy of the Japanese is the highest life expectancy in the world for males and females. And for both sexes, the life expectancy of 83.7 is the highest. Not only that, at least compared to America, there are many more centenarians, people who have lived past the age of 100. Now, a new study confirms what many people would suspect, that we have to look at what are the factors in this. We can't say that there's no pollution in Japan, because pollution can be a factor in cancer. And Japan was famous back in the 60s and 70s because sometimes traffic police had to wear a, what do you call it, a gas mask to stand outside and direct traffic. Of course, Tokyo and the cities of Japan are much better now, and they have very clear skies. But for a number of years, there was a problem with pollution. We can't say that there's no stress in Japan. I studied Oriental medicine in Japan, and I found that in Japan, just like America, there are a lot of people with stomach ulcers and high blood pressure and lots of stress-related diseases. And of course, acupuncture is very good for stress-related diseases. But there's even a word for working yourself to death in Japanese. So we have to look at the diet being the most important factor in the Japanese longevity. So let's look at the next slide, please. Scientists gathered diet and lifestyle data from 36,624 men and 42,970 women between the ages of 45 and 75. And they did an epidemiological study, and they found, as expected, that people that adhered to the traditional diet had had greater longevity, that they lived longer, and they lived healthier lives, and there was considerably less death from cardiovascular disease, which in Japan, this means that there are fewer strokes. So as you can see here, that the average Japanese diet is very high in vegetables, and seafood plays an important role with all of the important omega-3 fatty acids and that type of thing. But another important factor is the presence of natural enzymes and probiotics. There are foods like miso, which many Japanese people drink miso soup every day. They have the Japanese pickles, tsukemono, which are not pasteurized, they're not soaked in vinegar, so they're still very alive and filled with bacteria. There's a soy cheese called natto, which is very rich in enzymes. And natto has become famous recently because enzymes from natto have been researched for treating cardiovascular disease. So let's see the next slide, please. These are the traditional pickles. They're pickled in rice bran with sea salt. And as I said, they're rich in probiotics, which are, of course, friendly bacteria. And the probiotics in the intestines are extremely important for a number of things. There's recent research of how it saves lives in infant diarrhea, used for allergies, obesity, metabolic syndrome, high blood pressure, depression, brain health, skin problems, and even diseases like autism and multiple sclerosis. So the fermentation process is kind of a pre-digestion, so that it makes foods more available so that they're absorbed more efficiently. Let's look at the next slide, please. So what is BioBran 1000? It's a broad-spectrum immune modulator extracted from rice bran, which we just saw. Rice bran has its own beneficial effects, and it's been treated with enzymes from the shiitake mushroom, sometimes called the forest mushroom in English. And the result is a chemical compound called rice bran arabinoxylan compound. And it's made by a unique process and a unique patented process. It's used in clinics and hospitals to protect the immune system from cancer, chemotherapy, and radiation. So the next slide, we can see the shiitake mushroom, which grows, they farm them in forests. So they drill holes in trees and grow the shiitake. They're quite delicious if you've never had them. So more about BioBran. It's a patented food supplement, and it has other names. We'll see some of the names in other slides, but NGN3, BRN4, RBAC, and then there are a few others. Let's look at the next slide, please. The next slide. This is BioBran. We see here how enzymes from thread-like roots of the shiitake are added to the rice bran. So let's look at the next slide. I think that's the one we want. Yes, okay. So here, yeah, we can see there's the rice bran, and then there's the enzyme complex, which comes from the mycelia. And then the biological modification is the fermentation for several weeks. And the result is the rice bran arabinoxylan compound, which is the main constituent of BioBran. So according to a new study, I just found this the other day at Penn State Cancer Institute, published in March of 2021, mushroom consumption is associated with lower risk of cancer. This is a systematic review and a meta-analysis that looked at 17 cancer studies published between 1966 to 2020. They analyzed the data of over 19,000 cancer patients, and they found that there was a relationship between mushroom consumption and cancer risk. And we're talking about just very little, only 18 grams, which is about an eighth to a quarter cup of mushrooms every day, is enough to have a 45% lower risk of cancer. And we're talking about ordinary button mushrooms that are used as stir fries and used. We're not even talking about the powerful mushrooms like shiitake. And so a mushroom product like this that's cultured has even more advantages, because most mushrooms have very large molecules in them that are difficult to digest. That's responsible for the rubbery quality that the mushrooms have. When you ferment the mushrooms, when they're cultured, they're broken down. And when they're broken down, we get new compounds that are not in the mushroom when it's just eaten cooked or stir fried or eaten in a soup or a stew or something like that. So let's look at the next slide, please. So the benefits of BioBran, we can see here, immune modulation. I'm going to talk about that and just what that means in just a minute. But it maintains a strong immune system. It's safe over a prolonged period of time. You can take it literally for months or years. And it doesn't cause any overstimulation of the immune system. There are some herbs and supplements that stimulate the immune system that shouldn't be used in cases of autoimmunity, for example, or if the immune system is hyperactive, such as in allergies. It does not lose efficacy with prolonged use, and it can be taken at a very low maintenance dose for people who are having proper immune system activity. So the next slide is about how does it work. It elevates immune activity to match the challenges of today's environment. It increases B and T cell counts. B cells and T cells are lymphocytes, which are a type of white blood cell that play an important role in the immune system. And then it augments natural killer cell activity. I want to talk about natural killer cells in some detail, but they're also white blood cells. They're part of the innate immune system, and they're very important for health and longevity. In addition, BioBran has anti-inflammatory and antioxidant action, and it's been used to treat viruses, influenza, herpes, HIV. I want to talk a little bit about coronavirus later on. And it supports healthy cytokine activity levels. For those of you that aren't familiar with this term, the cytokine is a chemical messenger of the immune system, just like a hormone is a chemical messenger that's found in the endocrine system. The cytokine is a chemical messenger that tells white blood cells what to do, how to act, whether to become very active or whether to quiet down. So let's look at the next slide, where I want to explain about immune modulation. Immune modulation means that as a supplement, BioBran doesn't have a simple, single, one-dimensional linear activity. It's a smart food. So it stimulates pro-inflammatory cytokines. Probably the most famous cytokine is interferon. A lot of people have heard about it because it was proposed as being a cancer treatment decades ago, and it's used today for treating serum hepatitis. And then there's tumor necrosis factor alpha, which is another pro-inflammatory cytokine. Now, if someone has cancer and they take BioBran, the interferon and the tumor necrosis factor, the TNF alpha levels, will increase. They'll come up. However, if someone has an inflammatory disease, like such as rheumatoid arthritis, and if the TNF alpha is too high, like it is in rheumatoid arthritis, taking BioBran will bring it down. So it won't just increase the tumor necrosis factor off the scale, it lowers it down. So it has a normalizing effect on the cytokine activity, a balancing effect. And we'll see some of the other balancing effects that it has. Let's look at the next slide, please. So lymphocytes, it increases T cell and B cell proliferation. This means that if the T cell count or the B cell count is low, it increases them. And this is very important because a lot of cancer patients are taking chemotherapy, and this can lower their white blood cell counts. Now, there are two kinds of T cells. There are the helper T cells, which are called CD4, and the suppressor T cells, which are called CD8. And BioBran has the effect of balancing them. The balanced ratio of CD4 to CD8 should be slightly over 1 or more. And so this balance is maintained by taking BioBran. So this is another effect that it has as an immune modulator, because it will not push either one in an abnormal direction. It will bring them together. Macrophages are another type of white blood cell. If you've ever seen any videos of white blood cells in activity, macrophages are the big fat ones that kind of, they move around and they wrap around a bacterium and break it down. They gobble it up. That's an American expression. They eat it up very quickly. And the word macrophage means big eater in Greek. Then there are dendritic cells, which are another type of immune cell. The dendritic cells are called that because they look like dendrites in the nerve cell. They have kind of a string type of shape to them. The dendritic cells are important for helping the immune system to identify antigens. So it's important in helping the immune system learn to recognize things that it's immune to. And then finally, last but not least, are the natural killer cells. They're called NK cells for short, and it activates them. And we'll see in the next slide about how that effect takes place. First, a little bit more about them. They're part of the what's called the intrinsic immune system. They're the early defense surveillance. They release cytokines, they attack cells that have been infected by microbes, and they collectively regulate multiple aspects of immune responses. They also eliminate malignant cells, any cells that are cancerous. They break them down. And they also, their natural function is to get rid of healthy cells at the end of their life cycle. So senescent cells, or cells at the end of their life cycle, need to be broken down and eliminated from the system. But sometimes this doesn't happen if there's a lot of congestion in the cellular environment. So let's look at the next slide, please. So the natural killer cell will attach itself to an abnormal cell, and it injects it with granules. These granules swirl around inside the NK cell, and the swirling of these granules is indicative of whether or not they're active. So these granules get injected into the abnormal cell or the aged cell and literally exploded. It blows it up into tiny pieces so that it is quickly broken down and easily eliminated by the immune system. So the next slide, please. So they're very important people with low NK cell activity are more susceptible to cancer, autoimmunity, infections, especially chronic infections like Lyme disease, herpes virus, influenza virus, chronic fatigue, immune dysfunction, which can also be a viral infection. And then, as I mentioned before, immune senescence, which is when the immune system is not functioning well and the normal cells die a natural death, but then they stay there and create an unnatural environment. So let's see the next slide, please. Now, reduction of NK cell activity in stress. This is an important factor because NK cells are very sensitive, hypersensitive, we might even say, to stress and to trauma. So what happens is if someone has a physical trauma, or it's been studied for earthquakes, tidal waves, divorce, depression, every kind of trauma, physical traumas, every kind of trauma that you can imagine, they've researched it, and the NK cell activity consistently goes down. So we might say that low NK cell activity is a marker for stress. It's also nutritional deficiencies, stress from natural disasters, sympathicatonia, that means high sympathetic activity. That's flight or fight type of adrenal activity. So when there's a lot of agitation and adrenal activity, that's something that lowers the NK cell activity. Now, let me point out that the number of cells doesn't go down. You may have the same number of NK cells, but the granules stop swirling around. The NK cells are still there, but they're inert. They just stay there. They're leaning against the wall, whistling a tune while all the abnormal cells go streaming by, and they don't do their job. So let's look at the next slide, please. So this is more about trauma and NK cell activity, and it's an important point because the leading cause of a late death following trauma is infection. Now, late death means that you got hit on the head and the blow to the head didn't kill you. You didn't bleed to death, but 2 or 3 weeks later, catch pneumonia and die. And this is from infection. And the reason this happens is because after the trauma, the NK cell activity goes down and a person becomes very susceptible to infection. So you can read what this says. It helps to correlate. It correlates strongly with the effects of PTSD. And if there's a fairly serious trauma, the immune suppression and the low NK cell activity can linger for years. And an important factor here to mention is that when any patient of mine has surgery, there are 2 things I recommend. One is I recommend as soon as they come out of surgery to take high doses of proteolytic enzymes to prevent scar tissue from forming. And the other thing I recommend is using BioBran so that even though the surgery is a controlled surgery, and even though the patient may be taking antibiotics and other drugs, their immune system activity is going to be lower. And so the BioBran helps to support that so that there are not complications from being weakened from the surgery. Let's see the next slide, please. Okay, so here are studies that show very persuasively that BioBran causes stimulation of NK cell activity. This is gravity material on this. 68 patients, 2 weeks after treatment. There was a statistically significant increase. So you can see the blue is after treatment with BioBran, and the pale blue is before, and the dark blue is after treatment. And there was a significant increase, but there are cases where in as little as 2 weeks, the NK cell activity has tripled from using BioBran. So let's look at the next slide, please. This shows that it's dose dependent, that the more BioBran you take, the more increase you get in the immune system activity. And up to a point, I mean, if you take 10 capsules 3 times a day, you may not get a much better effect than if you take 3 capsules 3 times a day, which you would do if you had a very sick patient. So we can see after 2 months, there's a dramatic increase in the NK cell activity. So let's see the next slide, please. Okay, next we're going to talk about some other activities, and the tumor inhibitory effects of BioBran may be related to the NK cell activity and may be related to the general immune system activity, but this is to show that it's definitely being tested with tumors, with Swiss albino mice who were treated intramuscular with Ehrlich carcinoma cells. And as expected, they contracted cancer and right on schedule. And then after that, the research project began. So let's see what happens next. On the next slide. So on day 8, once the tumors had formed, they were treated with an intraperitoneal injection. This means that they shot the BioBran into the abdomen, and sometimes they injected the tumor itself. And so we can see how BioBran inhibited the growth of the tumor volume by 63%. And I think any researcher would agree that that's a highly significant difference between the BioBran group and the group that the control group that received no BioBran. Let's look at the next slide, please. So here are photographs of the tumors on the 35th day, and you can see that in the control group, the size of the tumor is a little over twice as large as the size of the tumor at the BioBran group. Now, my feeling is that it isn't even necessary for the tumor to go away completely. If the tumor is reduced, this in itself increases longevity. And if the immune system is boosted, that this increases longevity and well-being. Now, these are animal studies, and animal studies are useful, but probably the most important study is the next one that we'll see on the next slide. This is the effect of BioBran on hepatocellular carcinoma. This is a common type of liver cancer. It's a type of liver cancer that often occurs in patients who have had chronic hepatitis. And sometimes patients will have hepatitis for years and it can develop into hepatocellular carcinoma. Sometimes it happens very quickly. The importance of this is that there was one that both groups were treated with conventional treatment, but one was with the conventional treatment, that's the CT, conventional treatment, plus BioBran were in 38 of the patients, and the other 30 of the 68 patients were getting only the conventional treatment. And so the evaluation was done by examining liver enzymes, AFP and L.C. These are enzymes that are generally increased in hepatitis, the tumor volume, and recurrence and survival. And this is with real human patients with real cancer and carried out over a period of 3 years. And so let's look at the results. So on the next slide, we can see that there's a percentage of change in the tumor volume. So this is a randomized comparison trial. The patients with hepatocellular carcinoma taking BioBran had a reduced recurrence rate of the cancer, 31.6% versus 46% 46.7% in the controls. Now, recurrence rate, what this means is that when you have the tumor surgically removed, usually the cancer comes back. And there are cases when it doesn't, and we've seen this with BioBran, where patients who continue to take BioBran after the liver surgery, that the tumors didn't come back. But frankly speaking, usually they do, but there was a lower recurrence rate, a significantly lower with the BioBran group. The BioBran patients lived longer. At the end of 1 year, 76% of them were alive, but only 63% of the control patients. At the 2-year mark, 35% of the BioBran patients were survived. And compared to 6.7%, where I think that's on here, 6.7% of the conventional treatment survived for 2 years. At the end of 2.5 years, none of the members of the control group were alive, and 11% of the BioBran group had survived. And I once saw a lecture with a cancer surgeon who specialized in eliminating liver cancer. And he showed some slides of people who before and after surgery, and then showed slides of the recurrence of cancer 2 years later, and the tumors would come back. But the thing that really struck and impressed me is that some of the scar tissue in people who had been taking BioBran was gone. And scar tissue, cirrhosis of the liver is considered to be something that's irreversible. But some of the patients, even though the tumor came back, scar tissue from their previous hepatitis and their previous cancer had gone. And I've never seen anything like that. So that's a possible benefit. And I think it is possible with a proper treatment that people who have cancer surgery for it and take BioBran can have no recurrence at all. But at the very least, we see that they live longer. So please show me the next slide. Okay, this is a summary of that. This is more clear. So there are 46.7% survived, had lower recurrence compared to 31.6. 35% survived 2 years, only 6% in the control group, and overall reduction of tumor volume by 36% compared with almost no change for the control. So with the people taking BioBran, over 1/3 of the tumor shrank away. So the conclusion is obvious. BioBran in conjunction with interventional therapies may be useful for the treatment of hepatocellular carcinoma. I think that's putting it mildly. So please show me the next slide. Benefits of bone marrow and B-cell cancers, such as multiple myeloma, chronic lymphocytic leukemia. This is a preliminary study that was done. This, I believe, is a human study. The next slide shows increase in NK cell activity in brain cancer in vitro and in vivo. This is a mouse study, but as I said, the animal studies are not as conclusive as the human studies, but it's very difficult to get a human study for brain cancer approved by an ethics committee. So I think that that it's clear that and here it's called MGN3 or BioBran, that the increase in the NK cell activity itself is a factor that could help decrease brain cancer in humans also. And let's look at the next slide. So the rest of the slides on cancer, and we've got about another probably 15 slides or so. This is about quality of life. First of all, is the chemosensitizing effect. That's the first factor, that this can potentially reduce chemotherapy damage because people can get an effect from using less chemotherapy. So this is a study that was done with cell lines, this type of cancer cells. that are taken from breast cancer in CF7 and HCC70 with daunorubicin, a chemotherapeutic agent. Let's have the next slide, please. So we can see here that the to look at my notes here. So chemotherapy alone is the top. And then we see here that, I think what's interesting about this slide is that there's a dose dependency. You see that the more of the BioBran, here it's called MGN3, but it's BioBran. We can see that the higher the dose, up to a certain point, the stronger the effect. So with the 500 microgram per milliliter dose compared to the 1,000 gram was pretty much the same, but quite a bit stronger, twice as strong as the 100 microgram per milliliter. So this helps us figure out what the dosage should be for people who have cancer, breast cancer in particular. Let's see the next slide, please. So treatment with BioBran increased the susceptibility of the breast cancer cells compared to the breast cancer cells treated only with the daunorubicin. So if BioBran is an effective chemosensitizer, it may be possible to reduce the dosage of chemotherapeutic agents against cancer patients. Now, this is research that will have to be done, but we can see that there's a valid possibility of this. And let's have the next slide, please. So the side effects of chemotherapy are terrible: fatigue, anorexia, loss of appetite, vomiting, hair loss, weight loss. This is a randomized control trial with 50 patients who had advanced breast cancer with 6 cycles of chemotherapy, and that's a lot. 3 grams per day, 1 week before and 1 week after chemotherapy. So that's about 2 capsules 3 times a day. Next slide, please. So I think these results are really remarkable. No fatigue, no loss of appetite in 80% of the group A, which is the BioBran group. Nausea and vomiting, only 40% compared to 100% of the control group. Hair loss, 100%. All the women lost their hair, and just over 1/4 of them did with the BioBran group. There was no weight gain. In fact, probably weight loss in the control group, but 64% actually had weight gain, and 0% had any weight loss. And in 90%, blood transfusion was not required. And a blood transfusion, of course, is not a low-risk proposition, especially for an immune-compromised cancer patient. So let's look at the next slide, please. So the conclusion is obvious. By helping to optimize the immune system, BioBran can help maximize treatment success, but also minimize the side effects and improve quality of life. Let's look at the next slide. This, to me, is even more remarkable because the side effects of radiation therapy, to me, I think they're worse because they're permanent. It's extreme oxidative stress, which is an aging problem. The radiation can cause leukemia, as we know. It shortens the life, and so anything that can help with people get through radiation is extremely beneficial. So here we had 65 patients with biopsy-proven head and neck malignancies, stage 1 through 4, undergoing radiation therapy, either radiation alone or with chemotherapy. And the BioBran is being taken 3 grams a day, 2 weeks before the start of treatment, and for 2 months after the completion of treatment. And then after that, with patients, you can drop down to a lower maintenance dose. And then the placebo group had radiation and chemotherapy and radiation alone. So let's look at the next slide. So the clinical outcomes, there was no mortality, no loss of life. Blood transfusions, only 3% compared to 52%. Hospital admissions, only 6% compared to 63%. So almost 2/3 of the patients had to go in the hospital who were getting the conventional treatment. No metastasis. Of course, metastasis, that's the big killer. When cancer is metastasized, that's when the oncologists start numbering their days. 15% metastasis in the control group, 12% of infection, no infection in the BioBran group, no recurrence in the BioBran group. These are marvelous, good results. Let's look at the next slide. So it showed better clinical outcomes, better nutritional status, and the BioBran group was able to stay out of the hospital and have fewer complications and fewer transfusions than the control group. So let's look at the next slide. I hope I'm not going too fast, but I want to cover all of these because I think they're all really exciting, and I want to talk next about, these are actual quality of life studies. We've already seen that if we can use a lower dose of chemotherapy, and if we can have fewer side effects, that's a huge improvement with quality of life. In this study, 205 progressed cancer patients in late stages, and the BioBran group was getting complementary and alternative therapy by a clinic in Japan. It's called the Sano Surgery Clinic. And the assessment was quality of life and also survival rate after 18 months. So let's look and see what happened on the next slide. Immune enhancement. So this is their complementary alternative treatment. This is the control group, and this is a very good treatment right here. This is an enzyme that's used for immune enhancement, germanium, the Maruyama vaccine, oriental medicines, probably meaning Kampo or Chinese herbal medicines, diet therapy, which is the Gerson diet therapy, which is mostly vegetarian, but also includes some liver and some fermented milk product, kale, vegetable juice. They're also given probiotics, thermal therapy with heat, which destroys cancer cells. They're using enzyme SOD, which is superoxide dismutase. Doing coffee enemas. The purpose of the coffee enema is to help remove toxicity from the liver. It's not for colon cleansing, it's for liver cleansing. And it's a feature of many of the natural cancer therapies that are used in Germany and Mexico, which are the places I'm most familiar with. And then also psychotherapy. So that's a wonderful treatment right there. And that's going to help people improve their quality of life and help them to live longer just from doing this. Well, let's see what happened when they added in BioBran to this regimen. So let's look at the next slide, please. So the BioBran group, the differences here are, I think the most noticeable difference is, well, no, this is part of the structure. This is just showing who the patients are. These are the types of cancers they treated. So this underscores the fact that BioBran is useful for just about every type of cancer, including blood cancers. So we'll see the results on the next slide. Okay, so the big difference here is the total survival rate, 54.2% compared to 33.9%. That's a significant difference. So we have people in this program at this clinic who are not being poisoned. They're being supported. They're being given good food. They're being given cleansing. They're being given supplements. And out of all the supplements that they're taking, what happens when you add BioBran? You get an even better result, a significantly better result. And so they categorized the NK cell activity according to how low it was. In people with really low NK cell activity, there was a 42.5% increase. Whereas in this low NK cell group with the standard regimen, only 12.5%. And in the higher NK cell activity groups, there was also a similar increase, but in each case, the BioBran group had a significantly higher increase in NK cell activity rather than the natural medicine regimen alone. So I'd like to look at the next slide, please. So here on pain, malaise, nausea, anorexia, all of these symptoms, we can see that BioBran has improved the quality of life. Let's look at the next slide. So the effect of BioBran on life extension improved quality of life. The survival rate at 18 months of treatment was 54.2% compared to 33.9% for the control for the control group. And actually, because they found that no dropout in the control group survived, it means that the actual survival rate for the control group was 17.4%. So the survival rate by adding BioBran into this natural medicine regimen tripled survival. Next slide, please. So you can see here progressive and metastasized cancer patients had higher survival rate, better appetite, less nausea and vomiting than control groups. Breast cancer patients in a randomized controlled trial of 6 months duration, there was increased appetite. There were fewer needs for antiemetic drugs and less hair loss compared to the control group. And that's another important factor. If we consider that for many of the horrible side effects of chemotherapy, patients will be getting other drugs, antiemetic drugs and so forth. So if BioBran can prevent the need for more drugs to control the terrible side effects, then that's a further benefit of using it. And then advanced stage cancer, the various malignancies, there were improvements in physical activity and decrease in side effects during conventional treatment compared with conventional treatment with the BioBran and mistletoe therapy. This is a study that was done in Europe. And we don't have all the details of these studies in this presentation, but these research studies are available. And mistletoe is used for tumor reduction in traditional German naturopathic medicine. Cancer patients with various malignancies with chronic fatigue were found to have changes in body pH level, and so the connective tissue was less acidic, and the average fatigue scale was significantly reduced in the BioBran group. And BioBran protected the blood-producing tissues in bone marrow. Now, these studies that I just mentioned these were human studies, but this one is a mouse study. I don't think this has been done in humans yet, but it should be. But one of the important effects that was shown in this mouse study is that BioBran protects the bone marrow from being damaged by chemotherapy or radiation. And the bone marrow is where the white cells and the red cells are produced. If the bone marrow is damaged by chemotherapy and the white cell count is low, people will die of infection very easily. They'll catch a cold and it goes quickly into pneumonia and then they're dead. If their red cell count is low, then their fatigue is very low and their oxygen supply to the cells is very low. And this increases not only their fatigue, but their effectiveness and increases their chances of dying. So all of these are studies that show convincingly how BioBran improves the quality of life in cancer patients. So let's have the next slide, please. So the dosage, 3 grams a day for 1 month, then reduced to 1 gram per day. 3 grams a day is what we would recommend for a person who's getting chemotherapy or radiation or both. And then for general immune support, 1 gram per day, 1 sachet, or if the product is in capsules, that would be usually 2 capsules. Let's look at the next. Most workshops and webinars like this start with the safety, but BioBran is a food, and it's made out of rice bran and shiitake. It's a cultured food, and it's been used by tens of thousands, if not hundreds of thousands of users globally for well over a decade, over 4 patients in clinical trials. It's been used at extremely high doses. If you want to kill a rat with BioBran, you have to drown them in it, because there's, the toxic dose is extremely high. And so it's also not only non-toxic, but it's safe for long-term use. Here's another slide about safety on the next one. This is the acute toxicity, 30 grams per kilogram in a rat. This means that if you're going to kill a rat with BioBran, you've got to give them about, so do the arithmetic here. If you've got a rat that's like a third of a kilogram, then 10 grams is what it would take to kill them. And mutagenicity, that means does it damage the DNA? Does it hurt the cell nucleus? Completely negative. So next slide, please. Safe and effective for long-term use. Now, this is also, one of the important things to remember about, why BioBran compared to other immune supplements, because there are many. Number one is that it's an immune modulator, which we already went over. It's smart. It's not going to overstimulate someone's immune system. But another one is that you can use it for a long period of time and it doesn't lose its activity. There are many supplements and even drugs. The body adjusts to it, and the effectiveness of it diminishes, so they have to raise the dosage of the drug in order for it to have an effect. People who drink alcohol, if you haven't had alcohol in 3 months and you drink a beer, you can really feel it. But then if you drink a beer every night, you don't feel it until you have 2, maybe 3, maybe 4. That's called hyporesponsiveness. That doesn't happen with BioBran. So this is, I think, one of the other exceptional features about it that makes it a unique product. So let's see, the next slide, please. Okay, here's the summary, and you can read this briefly. Fermentation creates a superior product. BioBran is well researched. It was actually compared with other similar mushroom products. I've used other ones, and I have colleagues who use maitake diffraction, who've used other products that are similar, made with rice bran. And the comparison showed that the BioBran was considerably stronger, 6 times stronger than some of the other products, which means that it's worth the money because you get a stronger effect. And I tell people, because sometimes people react, say, well, that's expensive, I don't want to take that. I say, well, what is your life worth? If you take this product, every molecule will be used because it's pre-digested and it's completely broken down. It'll be absorbed 100% into the system, and your white blood cells will eat it for breakfast, lunch, and dinner. So I encourage people that it's worth paying for a healthy immune system. And as I mentioned, it's good for the elderly to improve longevity, because if you can remove the dead cells that died from normal physiology, then you have a cellular environment that has fresh blood and good drainage, and that leads to longevity. So let's look at the next slide now. I wanted to be sure and save some time for this because we have two case histories. It's inevitable that people are going to ask you about is, should we use BioBran for COVID? Well, we don't have any COVID studies. I don't think anyone has COVID studies. There are a lot of COVID studies for vitamin D that show that vitamin D is extremely important for protecting against COVID. But if we could go to, let's see, the next slide. No, actually, we don't. Let's go back. No, go back up. Okay. So I'm going to read these case histories. So here's a lady in Slovakia who was diagnosed with COVID-19. She immediately started taking BioBran 1000, one sachet 3 times a day. And after 2 days, her smell and taste returned. That's an exceptionally good result. It's called anosmia, and some people who have had COVID lose their sense of smell for months. And some people, I don't know if it ever comes back. Now, if you take zinc, that can help it to come back because a loss of smell is a sign of zinc deficiency. But here is BioBran with no zinc added to it at all that's getting the same effect of getting rid of the loss of smell. She says 5 days after use, her headache stopped and her sinuses cleared, and she did not get rhinitis or a cough. She said her husband and daughter were quarantined with her. They also took BioBran 1000 3 times a day and did not get COVID-19. And she was not isolated from them. They were living together, breathing together, eating together, and taking the BioBran. They did not catch it from her. So here is another case history. This one is, I'm not sure where this one is. I think it was in the UK. So I caught COVID recently, had all 3 children at home due to outbreaks in the school. So here is a single mother with 3 children, and she's got COVID. Her first symptom, she said, was a headache, aching bones all over, and then complete exhaustion. A few days later, she had a cough and chest discomfort, which led to her nervous system becoming imbalanced. Then she lost her sense of taste and smell. She said, after a week, I was a mess. She found it so hard dealing with the children and with homeschooling while feeling so sick that she began to get worried and she got weaker and weaker. A friend of hers got very worried and sent her some BioBran by mail. So she already has full-blown COVID with all these symptoms. She took 1 sachet 3 times a day for 3 days. And every day, she said, I started to feel more normal. 4 days on BioBran. Day 1, she said, my nerves calmed down right away, which was a huge relief. Day 2, her cough cleared up. Day 3, she was completely clear of all COVID symptoms, was back to her energized, stable, and healthy self. So that's only 3 days. I think that's a phenomenally good result. And I think, you know, in order to match that result, you'd have to have massive doses of intravenous vitamin C or something like that. Medical doctors in Bangladesh have also been using it in infected patients and observing fewer symptoms. So this slide is a study that shows that when NK cell levels are impaired, that this leads to severe COVID cases. So this can give us a mechanism how we can understand that if the BioBran increases NK cell activities, this is at least one reason why some of these patients who are using the BioBran for COVID-19 have done so well. And we have seen that the BioBran reliably increases NK cells in everyone. In some cases, enormously, it triples them in 2 weeks. In other cases, it increases them a percentage, but any increase in NK cell activity will increase the well-being and will reduce the symptoms and shorten the period of the pathology. So thank you for listening. I'm sorry if I went over time, but I'm really glad that I got to share everything because I think every single slide has important information. So our last slide is our advertisement for Daiwa, the producer of BioBran, also called our rice bran or aminoxylin compound, BRN4 MGN3. This is that's the end of my presentation. Thank you.